All right, welcome everybody. Glad you're able to make it today. This is our, I guess you would say, second annual mental health panel discussion that the Construction Management Program has put together in conjunction with our construction safety course. Obviously, most of you, we just went through a couple different things talking about mental health and how it relates to our construction job sites and whatnot. But today we've got an excellent panel that's going to share some stories with you. And at the end of this, we're going to have time to answer any questions that you might have. So with that, the first person I'll be introducing is Megan Hammes. She's with with Hammes Homestead and Consulting. The next person is Mike Farr. He's with Project Safe. We have Brandon Peters with Tri-County Enterprises. Taylor Ulrich with Kirkwood Counseling Services, and finally Polly Stevenson with Foundation 2. With that, I'm going to hand it over to Megan and let you take it from here. Okay. Thank you.
Thank you. All right, welcome everybody. I am Megan Hammes, and what I do through my business is go into different workplaces and do mental health awareness training. So just kind of why it is so important to talk about mental health at work, help reduce barriers and the stigma that surround help-seeking behavior. And as, life should have it, when I went out on my own after being at the University of Iowa for 20 years in employee health and well-being, I went out on my own. Almost every single customer or client of mine is from a manufacturing or construction setting. And I certainly didn't seek that out. It's because those industries are in the greatest need. And it's also in my DNA. I have a dad who's retired from a manufacturing company, a brother who still works a swing shift at a steel mill, and my husband works in construction. And so I know what it's like to be a construction family, gone a lot, safety, all of those types of worries. So feel so honored to be here today as the moderator. And all of you probably know this, but just a couple of kind of ground rules today. When we talk about mental health, often the topic of suicide comes up, and it will today as well. I just want you to know that having an emotional reaction, even if right at this moment you think you're not going to have an emotional reaction, it happens, and that is A-okay, all right? Maybe check in with somebody next to you if they're having an emotional response, but it happens, and that's wonderful. That's kind of the beauty of being human. And in light of that, we also want to respect the privacy of others, right? Kind of what happens here, what gets asked here, stays here unless you're educating others. And if you need it, ask for help. So one of us, whether it's myself or a panelist, we will be the last ones to leave the room. So if you need to stick around and if you need to have a conversation, just grab any of us that are still here. So yeah, those are some ground rules. So I have a couple of slides to kick us off, and then we're going to let the panelists introduce themselves, the work that they do, so you get to know us a little bit. And then we have prepared Q&A. We already have some student questions submitted, and then we really want to get to additional student questions. We all have mental health. I think you're here, you've selected to be here. Hopefully we know this. We all have a brain inside of our body. So when we talk about mental health, we're not just talking about mental health struggles and challenges. Every single person has mental health. And when you look at a continuum like this of health, we are all on a continuum. And day by day, we are flowing along this continuum. There's kind of positive and healthy physical and emotional health. And then there's that middle ground where maybe we are experiencing a challenge with our physical or mental health. We don't really need to delineate between the two. We're struggling a little bit. This is maybe where we're not getting the best sleep. We're not having the best emotional responses to stressors in our life. And then we have the further end of the spectrum, which is having a challenge, whether that be a chronic illness, a mental illness, what have you. So it's fluid all the time. And when we have a mental illness, we can recover or manage our symptoms. So just kind of want to set the groundwork for that too, that our mental health, just like our physical health, is on a continuum. So I mentioned that what I do, sorry, my slides look a little funny on this big, humongous screen. But mental health in the workplace is a huge topic. So there are groups, Total Worker Health, the former United States Surgeon General, who have done a lot of talking about the importance of mental health in the workplace. A quarter of adults experience a mental disorder each year, so it's very, very common. I don't know how many people are in the room, but just like visually drawing a line from about right here over, that's a quarter of us. That's a lot of people. Less than 50% will seek out or receive formal support and treatment. And formal support and treatment is almost always necessary for management or full recovery. And only about 50% of American workers are comfortable disclosing a mental health diagnosis at work. And there's a lot of very valid and good reasons people have for that. They're fearful that they might be treated differently. So we have a lot of work to do around education and stigma. And then 92%, that's almost everybody, right, say it's very or somewhat important to work for an organization that provides support for mental health. So younger folks are asking their employer, when they have a choice of where they're going to go work, they are asking, what mental health benefits do you offer for me and for my family? So that's very important. So the work I do in workplaces, if they're wanting me to come in and do a training, my first question is, do you cover mental health benefits and do you have an employee assistance program? Because if you don't at this time, I don't know what a workplace training is going to do if people don't have anywhere to go. Also, a lot of employees say work-related mental health has impacted their performance at work, and very, very important to acknowledge that workplaces, because of staffing and workload and just all the things associated with our work, impact our mental health. So pop quiz, okay? And these are just some numbers, and want you to try to make a few guesses as to what they mean in terms of mental health in the workplace. So 1/3, what might this represent in terms of our lives and work? Any ideas? Just shout it out. We're not going to go around with a mic. How long we work. Perfect. It's the approximate amount of time we spend at work. We should be sleeping, the other third should be. And then the other time we get to do, the rest of our life, our hobbies, our families, all of that. 50%. Any guesses? 50% represents the percentage of American workers with at least one chronic health condition. And of these, 50% of workers have 2 or more chronic health conditions. And I have some bad news for you. As you get older, which you can't do anything about, the likelihood of having a chronic condition increases. 50% though, okay? This is physical and emotional. So it's very important to take care of our workers that are spending so much of their lives at work. And then finally, 2/3. 2/3 of adults say that what is the number one stressor in their life? Sometime, yeah, I'm sure the other third said kids. 67% said the number one cause of stress is work. Again, workload, schedule, staffing, appreciation, and recognition. That's okay. Some amount of stress is good. But if most of us are saying our number one stressor is work, work needs to adjust and adapt a little bit. Not going to spend a whole lot of time on this. This is suicide rates by job type. This is why we're here. So a lot of our trades, manufacturing, construction, mining, far and away exceed the general population and other industries. So we have work to do. I also want to be very sensitive that when I show statistics on suicide, and our CDC gathers this from states, these are much more than numbers and statistics, right? We know that when somebody dies by suicide, there is a major ripple effect. And many of us are not immune to that ripple effect. Coworkers, classmates, families, first responders, and on down the line. So when we are talking about these numbers, the ripple effect across our country and across these industries is ginormous. So what is it about construction? This is information called the Fatal 10 in Construction from a group called the Blue Wall Institute. Probably a lot of the things that your instructors have talked with you about and you've talked amongst yourselves or you've seen on the job. Mental health contributors that are amplified in the trades and in construction. So we have interpersonal relationships, and again, I'm sorry it's showing up like this. I promise you it's not in my slide deck, but you get the drift. Interpersonal relationships, because when we are working long hours or on the road and traveling home only defined period of time, or we're having so much stress at work that we're kind of unable to decompress in a healthy way and talk with our partners and loved ones about that. Sometimes there are fractured interpersonal relationships. Substance use and addiction, not because the trades attract people that come in with substance use and addiction, but because of the nature of the work, there's often pain medication prescribed or just kind of the culture of what we do after work. Stress, sleep disruption and disorders, and also access to lethal means. So we have a population, primarily males, working aged. Access to lethal means on construction sites and for this demographic are greater than that of the population. So there's just added stressors working in this industry that are important to recognize. So finally, my closing before I turn it over to Mike is what are the industry best practices? And if you're not in industry yet, consider some of these things. And they always say it's best practice to go into an interview and interview your employer just as hard as they're interviewing you. Would encourage you to ask about some of these programs. Does the company offer access to an employee assistance program and covered mental health care benefits at the same level as other health care benefits? Super important. Are there stand downs or stand ups for suicide prevention? Because I guarantee you, if somebody gets a back or a head injury from not using their fall protection correctly, what's going to happen? We are immediately going to talk about this event. We are immediately going to have somebody on site holding a stand down or talking about this. Prevention is key for all of our safety efforts, and we need to take our mental health very, very seriously. So I want to see companies doing stand downs and stand ups for suicide prevention, not just in September, all throughout the year. And then finally, the work that I have been called to do is workplace mental health awareness trainings. So I have two up here. Mental health first aid, in my belief, that is the platinum standard. Tons of research, it's in 25 countries. And question, persuade, refer, which is a suicide prevention training. So these are endorsed by SAMHSA, NIOSH, and OSHA. There are other very good trainings out there as well. But I believe companies should be offering these proactively, not reactively. So that's kind of my introduction and setting the stage. And next I'm going to turn it over to Mike Farr with Project Safe. Thank you. Thank you. Mike, I'll find your slides for you.
I don't have slides.
Oh, don't have slides. Okay, all yours.
Good. Thank you, Megan. As said, I'm Mike Farr with Project Safe. September 22nd, 2017, I lost my middle child to suicide. He is 17 years old. He was a senior over here at Prairie. He was the class clown. He liked to be entertaining people and liked to have a lot of fun. But he'd been suffering from with depression since the age of 6. And struggled out there, and he had ups and downs and ups and downs and ups and downs. Too many to count. And we learned what we could to try to help him and try to save him. Didn't learn enough. If I learned more of what I know today, he might be here still. But I don't know. I can't dwell on that because you don't live in the what-if worlds in this situation. But the best thing you do is educate yourself. Educate yourself by learning the signs of what people are acting out there to determine if they are depressed or they might be suicidal. Learning the proper questions. And the proper question is, are you planning to hurt yourself? The question is, are you planning to end your life by suicide? It's a tough question. Second question is, if they say yes, do you have a plan? And if they have a plan, find out what it is. And then learn the resources within your community that you can take them to, whether it be Foundation 2, call 988. There's good information out there to help out to get the help you need. But most importantly, stay with that individual, follow up with that individual until you get them the proper help and can hand them off to someone that can properly handle them and help them through today, tomorrow, the next day. So I ask all of us to do that. The thing is, most people, they have their head in the sand. It's not going to happen to me. It's not going to happen to my loved ones or my family, none of my friends. And they don't learn about the resources because I don't need resources because I don't have those situations. So many people, after something happens, then they start looking for the resources. Well, it's too late then. It really is. I mean, you can get some help and everything, but you could have had preventative help out there to help you through these situations. And it's important for you to make sure you understand what are the resources out there. There's a lot of great resources within our community. We have an event called Strike Out the Stigma, and we have about 2,500 plus people at the event. It's over at Prospect Meadows, softball and baseball, and we have about 45 different resource tables there. And that's not all the groups throughout the county and the area. So I mean, there's hundreds of groups out there. And the most important thing also, if you go to a resource and you work with an individual and you're not the right fit, then you're just not the right fit. Search a new one. Don't be stuck on that, I only got to go with this person because I've got this much time invested. It isn't about your time investment. It's about what's working for you, what you need to help you and your mental health to move forward, to be here today, tomorrow, and forever. You are loved, people care about you, and you do matter. And you got to know that. So, Garrett, from his pain, I don't think that he necessarily wanted to kill himself. I think most people that die by suicide, they want the pain to stop. And I think that's the thing that's out there. The pain he had in his head going on, the conflicts and the whatever else out there. It isn't that he didn't love his dad, his mom, his brother, his sister, his friends. He loved them all. He just couldn't manage the pain anymore. My oldest son's 28, traveling nurse, age 8. He wanted to end his life. He had a lot of things going on in his life at that time, and he expressed many times that he wanted to end his life, so we took him to the psych ward and got him entered. And he got help he needed, and we moved forward. Freshman year in college, he went to Iowa. He wanted to be a doctor. Well, college was a lot of fun for him. I'd see him at the Iowa football games, the backpack with a bottle of liquor, and he'd be drunk at the events. And he felt he had sowed his seeds, and I tried helping him as best I could. His grades suffered, and second semester, he thought he straightened out. He said he's ready to go. But we could tell that it wasn't by the way he answered questions, how short he was with us and talking to us. So we pulled him out of the University of Iowa. On April 23rd, 2018, we had a community conversation similar to this with 186 people over at Prairie with a panel. And I was emceeing it. And my son, Brandon, told the crowd with his mom out there and me up top here that if we would have pulled him out of the University of Iowa when we did, he'd been in the ground before his brother. We knew he was depressed, but we didn't know he was suicidal because we didn't know the questions. We didn't know the procedures of what to do to try to help him. We had him seeing a psychologist. We had him talking with people, but it's not enough. So don't be afraid to talk about your mental health. One's mental health and talking about it helps. It helps a lot. Number 2, our foundation, Project Safe. I have a website called projectsafecr.org. I have literature out here also that if you can get information, come to our events, come and learn and get information and see others and be willing to talk. We have a lot of great programs throughout the community. We give scholarships away. We do co-pays for deductibles and co-pays that aren't met. We give grants away to help people up to $500 a year so they can't afford to pay for their mental health bill. We can at least help them get on so they can still keep on getting the help they need. We do community conversations. We do QPR trainings. So we do a lot of different things within the community. My goal was not to have a foundation that invented the wheel. There's plenty of great wheels out there in the community. I want to bring something else to that wheel as another spoke to help that wheel a bit better out there in the community, and that's what we've done. For the construction side of it, I was VP of sales for 25 or 30 years with Cascade Manufacturing. We're a component manufacturing company. I retired 4 years ago. I serve on the National Home Builders Association and have served on there for almost 24 years. I'm on the leadership committee, and I serve on health and safety with Tim Ruth over here from Iowa City, and I also am on the membership committee. I'm fairly involved with the National Home Builders, the state home builders, and my local home builders. So I do have a lot of commitment to this industry, and I love this industry. It's a great industry to be in. But there are challenges, and so don't be afraid to talk about those different challenges you have or what's going on in your head. And if you see a friend out there struggling, if you don't feel comfortable talking with them, maybe call 988 yourself and ask them what you can do to help out or how to pass off information to help out, or talk with someone, call Foundation 2 or someone else and see what help is out there, or call me. You can call me anytime, day or night. I do answer my phone. May not the first time because I may not recognize the number because I get too many Medicare calls anymore, which I'm not old enough for Medicare, but I appreciate the thought. But anyways, I get plenty of ARP calls too, but I am old enough for that, unfortunately. So anyways, you have a great group of people here that are going to give you some more information. Thank you for your time, and like I said, I'll be around. I have a lot of good literature out there that talks about the signs, talks about the awareness of what you need to know to help save life. And our tagline is Together We're Saving Lives, one life at a time. One life and time are all capitalized, because that's what each one of us can do. If we each could help save one life, we will make a huge difference in this community and other communities that we go to down the road. Thank you.
Hello, my name is Brandon Peters. I'm a co-owner of Tri-County Enterprises in Cedar Rapids. We are a contracting company. We specialize in exterior remodeling, anywhere from roofing, siding, windows, to exterior, outdoor living and decking. Known Mike for, well, I guess we just talked about it, 26 years. Tri-County, we sponsor Project Safe. We're heavily invested in mental health and our industry. We see that in the industry, it's very stressful. There's anywhere from a lot of pressure to get projects completed. There's pressure from, maybe homeowners with quality. There's pressures from other employees, other coworkers. Maybe there's a toughness, this macho kind of persona that we all have in this industry, so we don't talk about the mental health issues. So some of the factors that can happen is what we see is accidents. If you're distracted, maybe you're dealing with something in your home life and you're distracted at work, accidents can happen. That's something that we try every day to avoid, any accidents. Also, we can see maybe some production being reduced, or we're starting to see, maybe substance abuse. That's pretty popular in our industry. So what are things we're doing to try to correct these is obviously we try to recognize them. We try to have meetings on a regular basis. During our safety meetings, we'll discuss mental health, how to look for the signs, how to communicate with individually with our coworkers or as maybe our leadership team. How do we recognize and see maybe some struggles somebody's having, and we can try to address these mental issues amongst ourselves and offer help when needed. Tri-County, we do basically, if I have maybe a lead foreman come to me, says, hey, we're sorry we're a little bit behind on this job, maybe an individual is maybe not stepping up where they need to be, or they seem to be disconnected. There's a sign for us. I might invite that individual in and sit down, talk to them, try to figure out what's going on. It might just be something simple that we can solve easily, or maybe there's more to it, and then we can offer assistance by connecting them with people like Mike Farr's Project Safe. We do everything we can. We're going to continue to work on these things. One of the hardest things in our industry is to kind of change that stigma of the macho person. Understand, look for the signs, talk to them, try to convince them to either talk to leadership, find other ways, by contacting Project Safe, and kind of helping all of us work together to get through these tough times. That's what I have. Thank you.
All right. Well, hi, everybody. I'm Taylor Ulrich. I'm one of the counselors here at Kirkwood. So I'm just going to pull up my presentation real quick. Let's see if it'll... Cool. Okay. So one of the services... I don't know how to do that. Whoops. Okay. Well, I was going to walk and talk, but I'm just going to... If I start walking away from the mic, just forgive me. I'll come back to it. But so I'm here to just talk about one of the services, that you all have access to as Kirkwood students. So there are 7 of us licensed mental health counselors, and we also have an intern. But so these are some of my colleagues and myself. But we're here to provide support for things going on in your life that you want to talk about. So, for some people that might just be like the stress of being in classes, or maybe you feel like you're not sure what you want to do. Or, maybe you're having some relationship struggles or something. Or it could be something, that is, would be considered a tragedy or trauma in your life. It doesn't matter what it is going on. If you're feeling like, gosh, I just don't feel like myself, we're here to talk to you. There was somebody here yesterday, I don't know if you all saw, but it was with the Foundation Helinski's Hope. Tyler Helinski, he was a quarterback for Washington State who died by suicide, I think in 2018, but they have started a foundation. But one of the key points that Tyler's dad, Mr. Helinski, was talking about was you don't have to have experienced or be experiencing a tragedy to ask for help. So like for me, when I was, your age, starting in high school and then on through college, I didn't realize, but I was struggling with my mental health. And one of the things that kept preventing me from going to get help was just like, I hadn't really experienced what I considered to be a tragedy or trauma. I just felt like, oh, I just must be a sad guy or a grumpy dude, whatever. But, that's where it just comes back to, you don't have to have experienced something that other people would consider traumatic or a tragedy to be struggling with your mental health. So I really just like to advocate for that because I wish I would have heard it when I was in college. So something I like to touch on is just some of the differences in services, both like here at Kirkwood, but then just generally. So because I think sometimes mental health, navigating mental health, or just the healthcare system generally, but that's a story for another day. But mental health specifically can be kind of confusing. So, for us, the majority of the services that we provide would be similar to like your family doctor, or if you still see a pediatrician, or just a family medicine doctor, PA, nurse practitioner, or whatever. But the people who you go to when you're sick, or your yearly physical, different things like that. We provide the main type of service that we provide is those just kind of it tends to start out weekly, but it can be expanded. But we're just checking in, seeing how things are going, and trying to provide different coping strategies, or even just being a listening ear for whatever it is you're wanting to talk about. We also provide similar to like walk-in clinics, or like urgent care, if you all have heard of those. Maybe that's maybe you don't have a provider that you see regularly, but like, oh, I probably need some sort of medication. I've got like, I don't know, I have a sore throat, so I want to go get a strep test or something like that. We do provide some level of walk-in services, but by and large, we are more focused on that, the routine, the regular check-ins, what we call ongoing counseling. But there are different services out in the community that provide the walk-in clinics, such as the Lynn County Mental Health Access Center. There are places you can go if you're feeling like, especially if you're feeling like you're in crisis and you're contemplating suicide, or you just don't feel safe where you are. There are options for you to walk into. And then there is the emergency services, which we don't necessarily provide, but you'll hear from Foundation 2 here in a little bit. But there are options for if you're really in crisis, there are places you can go. Like I said, these are the things that we do, but especially as Kirkwood students, we can connect you with different services on campus, whether that be student assistants, who it can kind of be an advocate for you with your classes. The accommodation services, so if you have a documented disability or condition that could affect your ability to be successful in the classroom, they can help you with that. Career services to just navigate, job search, looking for an internship, or even just part-time work right now. Advising, financial aid, academics. We can help you get connected to different people. We also help connect with different providers, mental health providers in the community. So especially if for those of you who are in high school, and or maybe not planning to attend Kirkwood in future years, we can still meet, once or twice to help you get connected, because it can be kind of hard figuring out, okay, how do I know who takes my insurance and that kind of stuff. So we are always happy to meet with you, even if it's just on one or two times, to just help you get connected with somebody in your community, especially if you don't live in this immediate area. So last thing that I'll touch on before I turn it over to Polly is just, these are some important community resources. Whether you are Foundation 2, which again Polly is a part of. This is their number for those in Johnson County or nearby. Those are they have the community crisis services crisis text line. I volunteered there for I can't remember for how long, but during the pandemic. But that's a text option, and it's like a real life person who will respond, and you can communicate over text. So maybe if you don't feel as comfortable having a conversation on the phone, but you still want to reach out, crisis text line is another option. And then there's that Crisis Lifeline 988. I think it's also important to remember it says suicide and crisis lifeline. It doesn't, you don't have to be feeling suicidal to be experiencing a crisis. So sometimes people think of things like 988 as like a suicide hotline and specifically define it that way, but it doesn't have to. You can call if you are feeling like you need somebody to talk to, there's nowhere else to turn. That's a number that you can call. So just if you have your phone and you want to put these numbers in or take a picture, whatever. But there's literature out that I'm happy to help connect you with as well. So I will turn it over to Polly.
Hi, everyone. I'm Polly. I have been at Foundation 2 now for 3 years. I started as a school liaison, so responding to students who were having a mental health or behavioral health crisis. I really appreciate that Taylor pointed out, in order to reach out for help, you don't have to be experiencing any kind of suicidal ideation. Mental health crisis is self-defined. So I also appreciate, I can't remember who, it was Taylor again. He brought up that he kind of thought somebody else wouldn't be struggling with what's going on right now, but that doesn't mean that it's not okay for me to struggle with it. So anyways, I respond to people in crisis through our mobile crisis outreach program. Foundation 2 has a lot of different programs. I'm going to touch on the Crisis Center, the mobile crisis outreach, and then our mental health access center that we offer. So the crisis line, you can find our number anywhere. You can do a Google search. Out there on my table, I have a lot of different goodies, but if you could at the very least, grab one of these trouble coping cards, because even if you won't use it, you know somebody who could use it eventually. So the number is on there. We also answer all 988 calls. So we have that contract with the state of Iowa. So whenever you call 988, you're talking to a Foundation 2 counselor. Same thing with Your Life Iowa. There's a lot of different phone numbers. You end up being routed to Foundation 2. There's trained compassionate telephone counselors that you can talk to. It is completely confidential. I want to stress that because I feel like that's one of the biggest barriers for people reaching out is that they're worried about people finding out that they called or us sending ambulance or law enforcement, and that is so few of our calls, and it is only when that is the need. Only when there is like active suicide actions going on. It is confidential, it is free. So that is available 24/7. 988 seems to be the easiest to remember, but there are also other ways that you can access that crisis line. About 10% of those calls end up in a mobile crisis dispatch. So the caller can ask for counselors to go out in person wherever they're at. Most of the time it's in the home, but we've responded to restaurants, gas stations, everywhere. Parks, you name it. So when you're on the phone or when you're sitting by your friend who you're supporting as they call, you can ask for a mobile crisis. Or maybe the counselor's like, I really think you could use in-person support. Is it okay if we send someone? It is voluntary, 100% voluntary. We respond in less than 60 minutes. So it's that on-site, in-person crisis support. We offer a safe, non-judgmental space to be heard. If we do a suicide screening or assessment. We can follow up with a safety plan, and we can help you decide what next steps you want to take. So I'm going to stress it like a million times. It is voluntary. We do not do involuntary committals, hospitalization. That is not us. So what to expect when we respond in person? Most of our dispatches last about an hour of us talking through what the crisis is, what they're going through, what they've tried in the past that has helped, identifying some resources that could help you right now. And there are a lot of different outcomes when we end the dispatch. So throughout, we're kind of assessing what kind of level of care would you benefit from, and letting you know what all of your options are. So we made this kind of spectrum so you can see the different levels of care. So at the very least restrictive environment, we end our conversation. We may have a safety plan that you come up with and we support you in, and then we call you the next day to see how you're doing. Maybe you want some more support. We could refer you to our crisis stabilization community-based service. It's a long name, CSCBS program, where you can meet with a mental health professional every day for 3 to 5 days consecutively. And then we have a care coordinator come meet with you, usually in the home, but we can meet wherever. And we help you to work on some skill development or any kind of goals that you identify would help you through your mental health crisis. Whether it's finding food banks that you can go to, or support groups that you can attend, getting connected with a new provider. We've done a lot of family mediation. It's a really cool program. Again, it's free and it's voluntary. Maybe you need a place to go for 1 to 5 days that isn't the hospital. You want a place where like you can leave when you want to, but you still want to be able to meet with a counselor. You still want that support around you and that safe space. So we may refer you to a crisis stabilization bed. Again, it's voluntary, so only if you want to do it. We have the Mental Health Access Center that we could take you to and do what we call a warm handoff. And then there's also GuideLink in Iowa City that we could take you to. And again, it's a lot of support in a place that is not the hospital. That being said, about 1% of our dispatches end where the person is like, I need to go to the hospital. That's the only way I can keep myself safe. Then we support you in that, and we go to the emergency room with you, and we give them our assessment, and then we wait until you get admitted. No matter what the dispatch outcome is, whether you just needed to talk for an hour and you feel better, or it ended in hospitalization, you're going to get some follow-up calls, because follow-up calls are proven to reduce the risk of future crisis. So we will follow up with you the next day, and you're all adults, so the next day, and then on the 7th day, and in between as much as you need. We can help link you to therapy, long-term care coordination through your insurance. There are so many different support groups that we can help you get connected with for domestic violence, for sexual assault victims. We have a suicide loss survivor support group that we can connect you with if you have a loved one who's died by suicide. And then lots and lots of community resources that we can help get you connected with that could have gotten that mental health crisis spiraling in the first place, because maybe your needs weren't met in the first place. And then we offer some short-term care coordination when we go on a dispatch. And again, this is completely voluntary. So if you are like, I never want to hear from you again, please don't call me. We won't call you. You're welcome. That CSCBS program that we can refer to, just again, it's up to 5 days. It has to be consecutive for us to qualify it as in the program. And let's see, it would give you daily contact with mental health professionals, and do all that kind of care coordination, but like right there in person with you. So it's a higher level of care than if we just leave and do some follow-up calls. We have a law enforcement liaison program. So we have counselors that respond with law enforcement, and it just helps those calls come from a different mental health approach versus somebody's committing a crime and it needs to stop. It's more of a leading with curiosity to the dispatch. And then that mental health access center that we can help refer you to and bring you there. 1 to 5 day stay, you get to leave when you want to. And it involves counseling sessions, referrals to more sources, stuff like that. We also offer some different trainings. We offer QPR, we offer Assist, which is more intense than QPR. QPR is usually about 1 to 2 hours. Assist is 2 days, and it is really hands-on. What do you do when somebody wants to kill themselves and they are right there in front of you? We offer peer-to-peer general mental health trainings, stuff like that. So, are there any questions about Foundation 2? No? Okay, don't forget to grab one of these because it has our number on it. Thanks.
Am I good? Okay. Hey, thanks, Mike. Yeah. This is an outstanding panel. Thank you, all of you. We have a little bit of lived experience that was shared. We have people working in the trades, our support resources. So this is really how it's done. So kudos to Aaron and the Kirkwood team for pulling everybody together. So I have a few prepared questions for the panelists, but we're going to have time for audience questions. So if you're in the audience, think of your question, and we will have a roaming mic going around so that you can ask any of the panelists questions as well. So the first question that I have for all of you is, what is one thing that you wish you knew earlier on about mental health when you were earlier in your college career or in the trades? And Mike, I know you kind of started off with things I wish I knew. But invite you and all of you to elaborate on that.
Sure. My wife, former wife, had some mental health issues, and so did some of my children. But what I didn't understand until I lost Garrett was, why can't you just pick yourself up? Why can't you just get over it? Suck it up. Let's go. We're fine. It's not that big a deal. You're letting something drag you down that isn't that way. And I didn't understand that until I lost Garrett. And the thing with depression, it robs you of the opportunity to make a good decision based on what everyone else out there would be thinking might be a good decision. So you're robbed of that ability. I didn't know that. I didn't understand that before I lost Garrett. I do today. So I wish I had known that earlier.
My situation's a little similar. I grew up, we didn't talk about mental health. Looking back, I can see areas in my family that definitely mom had anxiety issues. My father had depression. And then I met my wife, and within a few months of us dating, she kind of let me know that she was on antidepressants. She was scared to tell me. And I was like Mike, I kind of said, well, why do you need them? Can't you just pick yourself up, smile, be happy, and all goes away? And over time, I really learned to understand the depth of what depression is for her and how she has to deal with it and how I can help. Took me a long time, but I'm there for her now. If I notice, maybe there's something off that day, I'm there to help her. It could just be a hug or how can I help? What can I do for you? Now we have children. We obviously care about our kids. We pay attention to them. What can I hear, see, do? And I noticed, one of our children are having an issue, and we definitely right away got them a therapist and got them the help they needed to deal with their depression and their anxiety. So I wish I knew sooner, understood things earlier.
Yeah, so I mean, I echo a lot of what they said. I'm gonna go with it's a little clinical, so sorry. I'll try and elaborate. But I wish I knew that the idea of that, or the concept that anger is a secondary emotion. So I know that sounds a little like woo woo. What is this dude talking about? Oh my God! But what that basically means is that like we experience anger, and that's like it's okay to feel angry. Oftentimes, that anger is masking or covering up some other maybe like base emotion, for lack of a better term. So, for example, last night about midnight, my daughter, I have a 3-year-old daughter, she came into my room and she says, "Dad, I can't find my Ariel Wawa." And so she's got this like, it's like a little water bottle with like Ariel from Little Mermaid. And I'm like, oh God, okay, all right. So I go into her room, I do a quick scan on her bed. I'm like, I'm sure it's just here, I can't find it. And I said, okay, Nora, can I just like, let's just go get you a different water. No. And so for those of you who don't have kids, try telling a 3-year-old who is half asleep that the thing that she is wanting is not going to happen right now, and it is not a lot of fun. So I noticed that I was getting, like, I felt myself getting angry. And, I think, God, 4 years ago, let alone 10 years ago, if I felt that anger, if I was in that situation, I would have probably blown my top and been like, "Are you kidding me? It's 12 o'clock at night. Let's just go to bed," and like stormed off. Well, then she's crying. Like, I wake up my son, my 1-year-old son. I wake up my wife. I feel like a total jerk. So, what I've learned through my own therapy as like a client, but then in my work as a therapist now, I was able to kind of take a minute and just think, okay, like I'm getting really annoyed, and that's okay. It is very annoying to be awake at midnight looking for something that is not that big of a deal when we have plenty of replacements. We probably have a second Ariel one somewhere. But what I realized was, okay, I'm feeling rushed because I want to go back to bed. I think I probably need to pee before I go back to bed, so I need to go to the bathroom. And I want to resolve this without waking anybody else up. And so I'm feeling worried that I'm going to like set off a 3-year-old tantrum, which is normal. She's 3, she can't regulate her emotions. Unlike myself, a 33-year-old man should be able to do that, or at least I'm working on it. But so it helped me, it took that little flick of a switch in my brain to just remember like, oh, right, like, yes, I'm feeling angry, and that's okay. Like, I'm not a bad person because I'm angry at my daughter right now, but I don't have to act on this, especially because at the end of the day, what I'm ultimately feeling and just is a harder, emotion, or maybe especially like as a male, is more difficult for me to acknowledge is, oh, I'm feeling worried. I'm feeling uncomfortable. Like I'm feeling other things beyond that. So to wrap it up, I think it's just important to remember, like, it's okay to feel what you're feeling, whatever it is. But when it comes to anger, if you find that you struggle with managing your emotions, especially when you feel angry, try and take a breath and just ask yourself the question, what else might I be feeling right now? Or like, what might this be about? And you might be able to have a better reaction to it.
I wish I would have known all the different types of treatment you can have and where to find those resources. I would have gotten help a lot sooner and saved myself a lot of grief and struggle. I always thought that going to therapy, I pictured like sitting or laying on a couch and just complaining and then nothing getting fixed. But that's not at all what therapy is. There are so many different techniques and types. It's so individualized, and it's what works for you. It doesn't take away my problems, but it helps me develop skills to get through life's problems. So if I would have known what it actually could be and how to access that, that would have been phenomenal.
Yes, thank you for sharing that, Polly. And that I want to expand on that a little bit, because in my role as a mental health first aid instructor going into companies, and I'm not a clinician, I'm not a mental health professional, I just do education. One thing that we emphasize as instructors is, therapy doesn't mean just one thing, that an image that comes to mind. Neither does medication. I don't want to have to take a pill for the rest of my life. And neither is true. Therapy and medication aren't always needed for the rest of one's life. And there's a whole world of therapy modalities under that umbrella. And so just as Polly said when she was talking, it's about finding what works for you. And there are some people, and we're going to kind of move on to the hard work that is the trades, that say, I will never, ever talk to a therapist. It's just like ingrained in people, I'm not doing it, I'm tough. Is find somebody who can listen to. So that could be a faith leader, somebody in your community, somebody in your family. It's really about helping navigate, find individuals who people are comfortable talking to. But love that you shared. There's a whole lot of different tricks that our professional mental health individuals have learned to work with people. It's just great. So I want to talk a little bit about some of the stigma that seems to be pervasive in the trade. So Brendan and Mike, this might be geared towards you. Taylor and Polly, feel free to weigh in. But the trades are often seen as really tough industries because they are. They're scary jobs, they're hard jobs. It is not easy work, it's not for everybody. And so mental health isn't always talked about openly because of this. Have you seen any new, creative, or innovative ideas to help combat this challenge in the trades? Or things that you've seen, maybe they're not new and innovative, but they've worked?
I know that a lot of companies today are having meetings, just like Brandon talked about, with their employees about mental health and allowing them the chance to open up about the concerns out there. And everyone's going to work as hard as you do, always in your mind. So that gets frustrating to certain people. And everyone's got to do the same quality as you do in your mind, and those get on people's minds and bother them. Everyone's not going to get the job done on time. People are going to waste time, and you're working hard. There's all kinds of things there, but having these meetings, talking about that, and getting everything in the open, I think that's what companies are doing today, just like they're doing with safety. I mean, they're taking this with safety and issues with OSHA to that next step and working with their employees, because it's just as important as OSHA is out there, which is all about safety.
We see both sides. I have kind of that old gruff contractor. We have those guys working for us. They have the stories that go back, that give them that macho kind of persona. We have the young construction worker that's trying to prove themselves, trying to be that tough one, generally the one that gets injured. The old construction worker, has kind of gone through their phase. They've learned it. They avoid those situations. The new ones trying to prove themselves. So what we try to do is we try to socialize. We do have our meetings. We also try to socialize, maybe send some type of groups. Maybe we get together, we play games. We try to put them together and socialize in a different kind of field than just working together. You know, what's it like to, play some silly game, but they work together to solve issues. They communicate. They become friends outside of that work environment, and they might be more willing to open up. Again, it's not just them opening up. We want others to see, kind of, if they hear something, see something, to kind of come to us and tell us about it, and then we can approach it and see if we can offer any assistance. So that's really what we do.
That's great. Anything to add?
I'm just thinking about how it really starts internally with you and in the conversations you have on the work site, driving to the work site with your coworker, at lunch, and are you creating a safe space for them where they're not going to feel judged? I think it really needs to start from within in the day-to-day stuff that creates a safer environment for people.
I just want to build a little bit on what Brendan said about like team building events. And one of the reasons it's not just a nice to do for a company, but good leaders really want their employees to know one another, because when people are exhibiting warning signs, it's helpful to know what's going on in their life. So if you know that somebody has a girlfriend or a wife, and then you know that somebody's going through a breakup or a divorce, that's super helpful information to know if you're maybe putting some clues together about mental health struggle that they're having. So it's really good. You don't have to be best friends with your coworkers, but it's very, very healthy to get to know them on some level. And then I just really want to give props to both Mike and Brendan, because one of the innovative things happening, or best practices, is when leaders, people in positions of power, are vulnerable and share their stories and aren't afraid to say it. That's a big deal. If leaders can do it, then front level people can do it. So kudos to you all. Okay, so a couple of other questions, maybe a little bit more of a lighthearted one. Is what's something that all of you do now for self-care, for your own mental health and well-being? And if you've fallen out of habit because you have young children, you're forgiven, but maybe what's something you used to do and would like to get back into. Does anybody want to share just some of your own personal self-care?
I can go. So two things come to mind when I think of this question. One is something I never thought that I would do, but got introduced by an old therapist of mine, was meditation. And so I know if you were like me, when I first heard that, I thought, I'm not going to do that. I think sometimes it can have a certain connotation, whether it be religious or just, again, like what I've heard as described as like woo-woo. But what I find to be so helpful about it, and I do it almost every day now for 8-ish years, is just it gives you time to just be there and like not do anything specific. You can let your thoughts just kind of come and go as they please. And so it really helped me both just like be comfortable just kind of being still and not having a stimuli all the time. We have, to sound really old, like we're just constantly engaged with our phones and blah, blah, blah. Like, but it really does help to just like kind of have a beat to just not be staring at something all the time or trying to solve a problem or whatever. But I also found that it helped me really, like, when I'm then in a situation that could be stressful, I found that it was helpful to help me, helpful for me in taking that breath, like I was talking about with my daughter. It gives me some space between what I'm feeling in the moment and recognizing that it's just a feeling, it's just a sensation. I don't have to act on this or do anything about it. The second thing that I do that I think is helpful and carries some stigma too is medication. So, for example, I took an anti-anxiety medication before coming here for this because I don't love public speaking, and I get super nervous about it. So, but there's lots of different types of medication for various types of mental health conditions. The thing that I often will say is, because I think similar to, or building off of a point that Mike made, people have the perception of mental health being something where, oh, why don't you just you just gotta snap out of it, or just convince yourself you're happy, whatever thing that people say. But sometimes that's not enough, or sometimes therapy's not enough. And so in that same vein, people who have this is not a call to respond, but for people who have allergies and take daily allergy medication, you wouldn't tell them suck it up, let alone somebody who has diabetes and is on dialysis, or somebody who's going through cancer treatments. They're taking medication for a condition. That's the same thing with somebody who's struggling with mental health. And so there is often a stigma around medication, but I think it's really important to remember that if that's something that works for you and something you want to try, that it's okay to do. And it's something that has helped me tremendously in multiple facets of my life. So
I like to golf. I'm a good golfer. But you don't always have 4 hours to do self-care, or $50 for, fees. So when I don't have a lot of time, I do paint by number, or I take a shower. It doesn't have to be a huge time commitment or expensive. You can just be purposeful with your time of I'm just gonna think about myself right now and take care of my needs.
That's awesome. I wish I was a golfer. I'm not, but I love the social and I love the nature, but not a golfer.
No.
Yeah, what about you guys? What self-care?
I do a lot of hunting and fishing, especially with deer season coming up October 1st. I'm gone from October 1st through mid-January for hunting. I'm leaving Tuesday for 2 weeks to Canada to go fishing. It'll be my second time to Canada this year fishing. I do a lot of traveling. I've been to Iceland, Norway, Amsterdam, Brussels, London this year, the Virgin Islands, American British, San Diego, DC, Vegas. Done a lot of
More than my
traveling
$50 golf.
this year.
This year.
This year. So I've done a lot of traveling. That's the nice thing about being retired. But, for my mental health, what helps me is events like this, knowing that I can make a difference in at least one person's life and be able to help them get through maybe any struggles they have. The one thing I didn't say earlier, but I'll say it now, is that everyone in this room at some point is going to have some type of disaster. Something terrible happen. And it's by what they learn and commit to learn about the signs, what they learn about the proper questions, and what they learn about the resources in the community will make a difference where they can save themselves, a friend, or a loved one. So no one is exempt from that. Something's going to happen. Just be aware of that and be prepared ahead of time.
Well, for me, unlike Mike, I'm not retired, so I'm at a stressful job. I'm, we're running a company, and to get away from some of that stress, sometimes I kind of just break free of it and work on another project, maybe that something for the future that doesn't really have any stress around it. I really like diving into research on maybe a new idea or a new service we could provide, just exploring my options. And that is something I just really love. And I think we've kind of, if I look back on it, we've built a good business through this process. So doing what I love is that research of it. But like Mike, there's one requirement that I've only done for about the last 5 years, but it's a requirement every year. I got to see a palm tree. I have to go somewhere warm in the winter because I've worked so hard all summer. It's time to recharge the batteries, go somewhere nice and relax, and we're going to be going to Aruba in another month. So.
Wow, that's
There you go.
great. That's great. Well, yeah, self-care, it's definitely not selfish. You know, to be able to care for ourselves and others, we definitely need to do things that fill our bucket. So thanks for all the different really wonderful ideas. All right, so we have mostly students in the audience. Are you still awake out there, students? Okay, it's Friday. Yay. So what practical steps would you encourage students who are entering the trades to take to both support their own mental health and that of their coworkers?
I'd encourage each student to, and we have some little flyers out there, but every morning do a self-evaluation on yourself. How am I feeling today? What kind of attitude am I going to have today? All those things transcend into what happens later on, like Brandon's talked about, and also revolves around your own safety. Because if you go to your day with the wrong attitude or not recognizing what's going on in your life, it could be your last day, especially in this business. So you got to be safe. So I've always tried to reevaluate. So.
I think it was Megan earlier talked about kind of interviewing the interviewer. Find a company that's got a good culture. If you go to a company and you don't enjoy the culture, you're young, find something else. There's many companies in your area. I highly recommend if you want to be an independent contractor, go to work for somebody first. Learn, like our business, remodeling. You get trained in so many different areas that if you do want to go out and start your own company, you've got a lot of experience of different sides of those trades to go forward. But don't just be comfortable with the first place. If you're not happy there, find a culture that fits you.
I think similar to something that Mike said of just doing kind of a self-eval or a self-assessment, but I'm thinking about it from the lens of, just taking a minute as you're applying for jobs or internships, whatever it may be. Like, what are the things that bother you? Like, what sets you off? Like, what are things that are things you might need to look out for in your job? So kind of similar to what Brandon was saying too, of kind of learning about the company, but then also just taking time to learn about yourself, think about yourself, and just identify things that you may be more sensitive to and that could cause you to struggle with your mental health. And then also, okay, so what could I do to help myself? Like what are things that help, like what are ways that I can do self-care, which is just, taking care of yourself. Who can I talk to? Is it setting up an appointment with a therapist because you're nervous about like starting a new job? Or is it like, you can talk to your partner, you can talk to your parents, whatever. But just kind of thinking through like, okay, what is it that, like, what are the things that could affect my mental health in starting this new profession or getting into this profession, and how can I take some proactive steps to make sure that I'm already managing it before it becomes a problem?
Are you good?
I guess just keep being curious about brain health and how you can help yourself and others. If you surround yourself with that kind of like literature, even when you're like scrolling and looking at videos, then that algorithm's going to pick up and it's just going to be like brought to your attention different good things like self-awareness and coping skills. Like it'll just be right there in front of you. So if you continue to be curious about it and surround yourself around that learning, it's going to be impactful.
Yeah.
I think be a constant learner also.
Yeah, bingo.
Be a constant learner, which Polly was saying. Mm-hmm. Keep your mind active and learn as much as you can about a lot of different topics. So that would make you interested in at least parties.
Good, great advice. So we had a couple of questions submitted before the event, and I think one of them got answered, and it was like, what are different stressors in construction and the trade? So You name it, there's a whole lot. It's culture, it's the hours, it's the nature of the work, sometimes intimidating or, almost scary when there's things you've never done before, can be dangerous. Financial stress is one of them, and then stigma. Maybe depending on where you're at, it might be harder to ask for help. So I think maybe that got answered a little bit. And then a question was submitted, what's the biggest cause of poor mental health in construction? And I've been thinking about this ever since Aaron handed it to me, and I don't think we can point to one single thing. I'm thinking about all the different research that I've done, and there's so much research and work being done specifically on construction mental health because of this rate of suicide, and I don't know that it's one thing so much as a collection of things. So I'm going to turf it to the panel to see if you have any insights, maybe data-driven or maybe based on your experience. Is there a biggest cause of poor mental health in construction that you know of?
I would say it's self-expectations and perceived expectations by others. I think those are the two key factors.
Okay, yeah.
I would say a balance between personal life and work life. Trying to keep that balance is difficult, and work, if you're stressed at home about something, work can really affect that.
Yeah. One thing I hear a lot about and talk with companies about also is sleep, and sometimes going at it from a sleep standpoint and sound sleep, because we know if we're lacking good sleep, we're less likely to make good decisions or safe choices. And so there's also a lot of things that can impact our sleep. Alcohol, substances, gaming. Not saying all of these things in isolation are bad, but if we overconsume them, binge watch a whole TV show till 4 a.m, that definitely impacts our work. And so I think the different things that impact our sleep as well can be contributors. So what I'd like to do now is we have an extra mic that we're gonna have roam. Thank you very much. So we're just gonna roam and we're gonna see what questions the audience have. Hopefully you've thought of some, and then we'll do our best to answer them as the panel. So if anybody wants to wave their hand, we'll make sure we get a mic to you. Don't be shy. Do they get any extra credit for answering questions? Okay.
Hi, I'm not a student. I'm a co-owner of a builder and remodeling company. I just want to comment on that, stressors. I think part of it is builders and remodelers are fixers and problem solvers, and so when they can't fix and solve the problem, that causes stress. So what we do in our company is when we have our meetings, we have like 10 minutes of, okay, this is a vent session. 1 is confidential. 2, just get it off your chest, complain about the customer, the subs, whatever, and then go back to, we know we're not going to fix the problem, we're just going to talk about it. So anyway, so I think I work with a lot of builders and remodelers, and they're all the same. They want to fix the problem. So anyway, that was it.
That's a great insight. Thank you for sharing that.
You guys gotta have some kind of concerns out there. I'm sure we didn't cover all your questions. I mean, it could be something simple. The dumb question is the one that's not asked. So don't be afraid to ask the question. Because someone else probably is thinking that same question that's afraid to raise their hand to do it. Don't be the ones afraid to do it.
Get them talking.
I'll keep this going. So I'm also a mom, and my work with young kids, my experience is, like Mike said, they want the pain to go away, but they don't realize that death is final. Is there anything you counselors do or say to these kids that, do you realize, I mean, I know logically death is final, but do you know what I'm saying, Mike?
I do. Garrett played a lot of video games, and in a lot of video games, he was killing a lot of people. he'd hit reset, and he was back alive again and get going again. And I think the people, and that's just a thought. There's ones that play video games that do that and do a lot of it. The death doesn't seem as real. I think that it's you can hit a reset button and go. I think that'd be a concern of mine. But like I said, that was just something I think that Garrett, I'm not sure if he fully understood the consequences of this is it. He wanted to end his pain, but I don't think he necessarily expected that he would stop living. He'd be able to reset, no more pain, and then things would be good again. So I'm guessing that's what I would say that.
I think that is a lot of people's experience, is that they don't understand that it's final. I also have been with people where their experience is that's exactly why they want to die, is because they know it's final. And so as counselors, when we're sitting with people in these moments, we are trying to get them just to focus on the next 24 hours and getting through the next 24 hours. Those are our most high risk clients. And so just getting them through that stage, I can't remember the exact amount of time, but if you can limit their access to means and get them through, I think it's like 70 minutes of that time where they're really committed to this plan where they are going to die, then if you get them through that 70 minutes or whatever that number is, most of the time they look back and they are like, that was worse than what I feel now, and now I'm a little bit better. And then you get them to see that it does get better. You got to get through that rut, that deep, deep, dark place. But yeah.
Yeah, I think similarly, and really just kind of what everyone's been saying is helping people realize that, you know, maybe not all the time, like there are certain people but I think sometimes people aren't aware that when they're wanting to die, like they're not consciously aware that what they want, like what they're seeking is for the pain to go away. And they've tried all of these other options. It seems like their options have been exhausted, and so death seems like the only other alternative. And so I think it's helping them realize, so is like helping them understand, like, is it that you want to die, or is it that you want the pain to go away? And then from there, kind of like what Polly was saying, is helping them identify what could make the pain go from, you know, a 10 to a 9 or a 10 to an 8 by the time we're done talking today. You know, it's not going to happen in a day or in a moment. It's not like problems aren't going to just like resolve. But is there something that we can do to just start getting somebody on that track toward feeling a little bit more like themselves? Yeah.
And also, we have learned so much from survivors who have survived to tell their story about what they were going through when they were thinking about dying by suicide. And Mike said something when he was up at the podium that I hope everybody heard, that's why we ask people directly. We don't say things like, you're not thinking about hurting yourself, are you? Because in the mind of an individual, they're saying, no, I'm not hurting, I'm helping. I'm helping myself and I'm helping others. I'm putting this misery away. So we want to ask very directly about intentions. Are you thinking about killing yourself, or are you thinking about dying by suicide? We want to ask very directly to get them through that window that Polly was talking about. It doesn't last forever. And Kevin Hines is an individual, and I'm actually wearing one of his shirts, Be Here Tomorrow. He's a suicide survivor. I don't know if you've heard his story. He has some great YouTube videos, but Kevin Hines is his name. And he is a much better storyteller than I, so you can look him up. But he talks about his journey out to the Golden Gate Bridge, which was famously known for people going to die by suicide. And he was giving clues. He was crying on a city bus, and he said, you know, if one family, if one person will just look at me and ask if they can help or ask me what's going on, I will stop. I will turn around. And the only question he got was somebody that wanted him to take their picture. And then he got off the city bus and started walking and making his journey out onto that big bridge. And he was, again, saying to himself, if someone stops me and sees these tears in my eyes, I'm not going to do it. Well, he did. He did do it. And he has dedicated his whole life to saving lives, kind of like Mike has done. And so I think, too, what do we tell these young people? It's that it's not going to feel like this forever. And that's not me just saying that because I care about you. We know it won't feel like this forever because people who have survived have told us it doesn't feel like this forever.
I think one more thing that I think about every time I'm with a client is that they don't see suicide as the problem. They see suicide as the solution to their problems. So I'm going to say that one more time just because I think it's really, it helps you see it through a new lens. They don't see suicide as the problem. They see suicide as the solution to their problems.
I think I saw, yeah, good. We've got a question in the back and then one in the front after this question.
Thank you all for being here very, very much. Do you have tips for the caregivers or for the friends? Like I have preteen and teenage kids and they're like, hey, my friend's mom struggles with depression. How do I help my friend? How do we help the family members? Those of you, like, what is the best way to support them in this walk? Because I feel like they're often, the unsung heroes sort of through this, and they need the support as well. And so just wondering, and as an employer, I have employees with spouses and children struggling and trying to figure out how do I best help them besides refer them to our EAP? Like what questions can I ask? What can my kids ask? That would be great.
We have some flyers out there that would answer some of those questions for you about signs, about talking, about making plans to figure things out that way, to have that conversation, get it started. If you have questions, though, Foundation 2 is a great resources out there. When Garrett died, I didn't know Foundation 2 even existed. Didn't know anything about Foundation 2. Foundation 2 is the largest organization within this state. But I had no clue of them because I didn't know about the resources available. And so I tout them all the time, but, don't be like me. Be aware of the resources. Don't be unaware, and then when you need them, then find them.
I think offering that safe, non-judgmental space where they can talk. A lot of our dispatches, as I'm training new counselors, I'm like, 90% of the time you're listening. There should be silence. It shouldn't be you trying to fix their problem, which is hard because we want to be fixers, right? We just want to fix it for them. But sometimes you just have to listen and withhold advice sometimes. But offering that safe space so that way when they're ready to open up and talk to you, they know they can go to you. And making sure you're aware of the signs and that you ask directly if you notice those signs. Hey, with everything you've been going through, I'm wondering, are you thinking about killing yourself? Or are you thinking about suicide? I've asked that question, I don't know how many times, and nobody has ever been upset with me for asking that. Even in a non-professional capacity, like with my friends and family, through that perspective, nobody has ever been upset with me. It's either you see immediate relief that like somebody said it, like somebody actually sees me, and now like I feel like it's like a relief. You can just see it. And then there have been times where they're like, no. I was like, oh, okay. And then we carry on with the conversation. But nobody has ever gotten mad. So
For
Sorry.
caregivers, I think of practical support as well. So not unlike if, friend's mom is going through breast cancer treatment, for example, how do we support those kids in that family? I think of practical support. So, we're Midwesterners. We like to do meal trains. We like to help mow the grass. I think with mental health, because there's more of a stigma, sometimes we might want to ask permission, like, hey, I've been thinking about helping you with the kids, the dog, the yard, the food. I've been thinking about helping. Would it be okay? And then also, I think we're very good at, I observe this all the time, hey, let me know how I can help. Bye-bye. Don't, give people choice, A, B, or C. I can bring you lunch or dinner on Monday, Tuesday, or Wednesday. Which day do you prefer? So I think just some of that practical support, and if we can, treat mental health just like we do our physical chronic health conditions, where we do seem to rally a little bit more around families, I think that's very helpful as well. Great question. I think there was one in the front. Yeah.
Can you touch upon leave of absences from work and the intermittent, extended, your rights, not your right, your rights from the government for
Yeah.
that as well? Because a lot of people don't know.
Question is leave of absence from work. I'm comfortable taking that question. I worked in human resources for 20 years. So Family Medical Leave Act is 12 weeks of protected leave. Sometimes it's paid, often it's unpaid. But with a documented medical condition, we have the right, whether it's 12 weeks at once or intermittently, to be gone from work for a condition, and that is protected. The softer side of that's kind of some HR legalese and what we're bound to do and what we must do if we're an employer of a certain size. The softer side of that is having employees, leaders, HR professionals pretty clear on what some policies are around leave. So we have fairness and equity amongst the workforce, but we allow people to tend to their needs. I have never heard of a company letting somebody go for their cancer treatment. It is worked out, they need to be gone, they need to do their treatments, we want them to live, we want them to get better. Maybe there comes a point where somebody does need to, they've exhausted their leave and go into an unpaid status or use some disability, what have you. But we also need companies to be very comfortable treating our mental health conditions with that same kind of care and support. So hope that answers your question a little bit. Oh, it was a plant. It was a planted question. Yes. So there's rules and laws, but again, people are very timid. They're afraid to come forward. Over 50% of people say, I'm not comfortable telling my employer about a mental health challenge because I'm afraid of what will happen to me. I had somebody in a training yesterday say, my former husband was a pilot and he struggled, but he'd seen people lose their jobs because they disclosed a medical condition. So it makes you pause and think, okay, that's real. That's a real barrier. So we have a lot of work to do around, this is awesome, just being able to talk about it and have so much hope for our youth because you are talking about it way more than my generation did, and that's good. That's a good thing. There was another question. Good. Plenty of time for questions. This is great.
Hello. How can I know that I am mentally ill?
Can you say that again? I just heard mentally ill. I'm sorry.
Yeah. How can I know that I'm mentally ill?
How do you know if you're mentally ill? Okay. Screenings. You mentioned screenings.
So Megan mentioned that everybody has mental health, right? And you said continuum. I love that. So we all have mental health. We all have bad days. There are specific diagnoses that count as mental illness. And you go to what's the word I'm looking for? Just any practitioner who can diagnose it. They look at Are you experiencing this in multiple environments, or is it just one environment? How often is this happening? They look at all the different, you take this.
So, no, you were doing great. So I think like to just key on what Polly was talking about is like, you don't have to know if you're mentally ill or mentally well or whatever, because one, it's a continuum. It's hard to know, but then two, like there are people there to help you, you know. So if you're wondering like, God, I don't really feel like I'm doing that well, maybe it's starting with your family doctor, because sometimes things that, you know, like if it's poor sleep, maybe that could be a physical condition or something going on, or it could just be like you're feeling really anxious and so it's hard to settle your mind at night. But so I think the biggest thing is just is reaching out and asking for help. There are also somebody mentions different screenings. Like I know on our website, or maybe not directly on our website, we may have a link to it, but we have a screening tool available that just kind of runs through just some general questions about how you're doing. And then may point you to, hey, maybe you should think about like talking to somebody. But yeah, so I think again the big thing is just I don't think you have to know if you think you may not be feeling all right, and you want to talk to and you think it's worth and you want to know or have better clarity, you can talk to somebody. No, I've never had somebody come into my office and say like, well, I don't think I'm feeling that great. And then we talk and I'm like, well, why are you here? Huh? Like, no, I want, if you don't feel great and then the only time that we meet is that one time, because after that you're like, okay, I think I feel good. I just needed to like get something off my chest and now I don't feel like I'm struggling like I was. That's okay. So again, my biggest advice is my biggest best way to answer the question is you don't have to do it alone. You don't have to know by yourself. You can talk to somebody, and we're all here to help at least point you in the right direction.
If emotions last longer than you would typically expect them to, that would be a gauge. So it's okay to be angry and it's okay to be sad, but if those emotions last longer than what you think they should be before you feel better, if it's going on for a really long time and not resolving, so, you know, some of us get a little blue in the winter months, in Iowa especially, December, January, February, but, you know, weather gets better and it's June and I'm not feeling better, that's a long duration of feeling bad, so that's kind of a clue. And then if feeling bad or blue or down gets in the way of just doing normal activities, getting yourself to work, getting yourself to class, getting out of bed, or not able to sleep, those are indicators that you should visit with a professional. I can't really see with these lights. Are there any more questions? Okay, great.
This is weird. I've never really used a mic. In the small business setting, how does a employer kind of start the conversation with the employees, especially when you only have 4 or 5 guys, to start discussing mental health and reaching out and supporting the small businesses?
Well, generally, you know, we there's some type of indicator that we're gonna talk with an employee, but our door's always open. If I have an employee that directly works for me or not, every single employee has my cell phone number. It's not unusual for me to get a phone call on a Saturday on their day off to talk about an issue, and I love that, and I'll never change that. If we can talk, figure out what's going on, maybe it's a simple work thing that I can address, but maybe it's more, then we'll continue that conversation on Monday morning and start that process. And sometimes it's, for me, maybe it's they're having some personal issues at home, and I just need to help them maybe tailor their schedule a little bit. They need to be off at 3 o'clock on Wednesdays, or maybe that it's the opposite. Maybe they're not getting enough hours because the crew they're working with is done at 3:30 every day, and hey, can you move me to this crew? They work till 6 so I can get some overtime and make some more money. So we try to tailor our help through those channels.
Brandon, are you hiring?
We're always hiring.
Okay. I'd work for him if I was you.
Suicide is a preventable death. And I can't say this enough, but learning the signs, learning the precautions, and learning the resources, if you all commit to that, that's more eyes out there, more of us that can help save those individuals that are struggling, including ourselves. Secondly, there's a lot of accidental deaths by suicide from overdose. So I've had 3 hips replaced on my right side, 1 hip on my left side, and my right knee. The last time the hip got replaced, the first night in the hospital, they gave me a bunch of pain meds because I had to get wheeled in because I couldn't even walk, putting pressure on my leg. Well, they overdosed me in the hospital. They had to Narcan me. And I remember they were talking and saying that I was non-responsive, that I wasn't coherent, I wasn't saying stuff. In my mind, I was looking at them, and I was saying, I can hear you, I'm fine. But apparently my lips weren't moving at all, because that's what the medicine did to me. But I never expected ever in my life, because I've never been a drug user or abuser of alcohol, about having an issue where I need Narcan, but even in hospitals. And I know that Garrett, on his death certificate, he had alcohol on his system, and he also had some marijuana, so that it was in the system there also. So a lot of people that are suffering abuse drugs. They abuse things out there to ease their mind, to be able to cope with their pain, and in the end for Garrett, to cope with the ability to end his life. So if you see friends that are out there and they are using substances, those substances kill. They have the opportunity to kill because it helps their mind relax to a point that they may do something that they're not fully aware of what they're doing.
Something that I'm thinking about, and it applies to your question, but then also your question about like talking to caregivers, but then like how to start a conversation about mental health and small business. I think in any conversation about mental health, I think one of the things that I remember thinking before I got into this field was, worrying like, oh, am I gonna, like, I need to ask this like well or right or perfectly or delicately, or again, especially in the case of suicide, like, am I gonna plant that thought? Well, to answer the last question first, by asking if somebody is feeling suicidal, you're not going to plant that idea. The people who are not suddenly going to think of that as a plausible option, and the people who have already been thinking about it. And so, like Paulie said, it kind of gives them the space to just like share and just have that, speak it out loud per se. But then, even if it's not about suicide or safety, just asking like, hey, how are you doing? Like, you don't have to, it doesn't have to be this like really fine, like well put question, So again, to use another example from my life, I work in mental health counseling, so I have these conversations every day. But my brother came to visit, and I've known him my whole life. We're twins, so I've known him before my life. I've known him a long time, but I still I just wanted to see like how he was doing. He lives in Atlanta, Georgia, and I live out here, and so we live far away from each other. And then our older sister and parents live in Virginia, so we live far from our family and then far from each other. And so I don't see him much, and I see his wife even less. And so, you know, I just wanted to ask how he was doing. I had no reason to think that his marriage was doing poorly, and it's not. It's going well, as I later learned. But I felt like I wanted to just ask because I wanted to ask to see how he was doing in case something was going on, and because I care. But I didn't know how to ask that. So I was like, but I just thought, well, it's like if I feel like this is important enough that I'm thinking about it this much, I'm just gonna try asking it and just see, like, even if it's clunky. And so I think I was gonna, like, so I don't know how to say this, Chris, but I mean, like, I'm not saying that I think anything's wrong with your marriage, but like, how's it going in your marriage? And then we just kind of laughed it off, and we're like, oh yeah, you know, like, yeah, it's kind of awkward to bring that up, but like, you know, he appreciated me asking. We talked about how things were going for him. We talked about how things were going for me, and it was a good conversation. But I share that to say, you know, like, I do this for a living, but like, I don't always know how to ask the question I want to ask either. But it's okay. It's that you try and that you are asking that matters. And 9 times out of 10, it's not going to be the way that you asked that they remember or that they care about. It's that you did ask. And so I think that's just an important thing to keep in mind.
Any more questions? Yes.
Did you guys see that? Dave's a track star.
Yeah, thanks, Dave. Getting
No,
his
my
steps
question is more on the caregiver side too, and I think you may have answered it, but Brandon, you talked about understanding what your loved ones have gone through. How do you figure that out? I guess the question is, how do you begin to understand, or what tips or tricks helped you do that? Just as a lot of us maybe aren't feeling, well, I'm not mentally ill, but somebody else is. How do you understand that?
Yeah, it took me a while. You know, I would say the wrong thing or do the wrong thing, and I think at one point it started with my wife of, you know, how should I respond? And she said, you know, well, when I'm complaining about this or that, kind of, we've heard it, I'm not looking for you to help me. I'm just looking for you to hold my hand and help me, you know, help me through this moment. She knows how to solve it. That's not what she was coming to me for. When it comes to my children, that's a little tougher. Sometimes they don't want to talk to me, but they might talk to each other. So I kind of pry to the other one. How's this one doing? How's that one doing? You know, my oldest was on his way to Chicago for a concert this weekend. He's in college, but I tried calling him and he didn't answer. But 10 minutes later, my high school student or child got a phone call from him. They just wanted to talk, so they talked for a half hour while he drove to Chicago. But I guess for me, it's just trial and error, asking the right questions, but asking them what I can do.
If you guys visit NAMI website, it's the National Alliance for Mental Illness, they have tons of free, really great resources on understanding different types of mental illness. So if you have somebody who specifically has depression or anxiety or, you know, ADHD is very common, and that is considered a mental illness. And you can just learn about what they experience and other really helpful tools as a caregiver and as somebody who may have that. They're very common. 1 in every 4 adults have a mental illness.
And I think, too, don't let people suffer in silence. So it's not so much what's the right thing to say, but saying nothing at all is the wrong thing.
I think something that I think about is just, and maybe whether it's just acknowledging it to yourself or acknowledging it to your loved one, it's like having a conversation with your loved one about it. But like to kind of to Megan's point and what other folks have said is like just like asking and trying to learn, seeking out the resources, and then, you know, again, whether it's just to yourself or if it's just the person that you're trying to better understand, it's saying like, hey, I'm working on this. I'm probably gonna mess up. I'm probably gonna say the wrong thing. I'm gonna be confused, but like I want you to hear from me now, especially in sidebar. I have ADHD, so I sidebar a lot of conversations. So yeah, so.
Can you tell in like my answers?
Oh God!
So-
Well, just my leg
like,
shaking. Yeah.
Yeah,
So,
It's very common,
so
very common.
it's like
Normalizing.
I think that I think it's important to just like recognize that like you may not get it right all the time, but acknowledging like I think letting them know that you are trying, and in a time or in a place where maybe it's not like maybe like let's say you said something and they're like, well, that wasn't helpful, and like you know you're having an argument or something. Well, I'm trying. It's like, oh God, like that. Maybe not the best time, but like if you have a down moment later, and it's not necessarily coming up. It's just like, hey, I just want to let you know, like, I know we've talked about how like I don't understand what you're going through right now, but I just want you to know I am working on it. Like, you know, I'm utilizing these resources, but I'm really trying to listen and to understand. And I recognize that I won't always get it right, but I just hope you know that I'm doing my best because I care about you and I want to understand. I think that's like, you know, it feels a little cliche or just like, but I think that's just the important thing is like, this is complicated. Like we're, to Megan, I think it was Megan who said like, you know, we're not like, I'm 33. I don't see myself as 33, but I feel 40. But like, I think even I was in college 10-ish years ago, we are not talking about mental health. We were not talking about mental health the way that it is talked about now. And so I think it's also it's just recognizing, giving yourself some, you know, some room to learn because like this is all pretty new for us collectively. And so we're still trying to understand. So we're probably not going to get it right all the time.
I think along with mental illness is people are just starting to realize how complex trauma can be. And just because you don't have a mental illness doesn't mean that you're going to have some big struggles because of different trauma in your life that you may not even remember. I used to think that trauma was only for people who were in active duty in the military, but it's so much more than that. So you guys have so many resources at your fingertips where you can learn about this kind of stuff. If you learn about ACEs, if you learn about just complex trauma and what it does to your brain and understanding maybe why you respond the way that you do, I encourage you to keep exploring those resources. There's so much free stuff out there.
All right, well, as much as I hate to do this, we are on time constraints, so we're going to have to end this. But before we do that, I do have a couple announcements at the end. But let's thank this group for being here today and for Aaron helping to put this on. This is really just the beginning of a discussion. As they have said throughout the entire time, the first step is just either reaching out or trying to help, all right? So this group will be here afterwards. There's a table out front here with additional information. I encourage all of you to stop by and ask a few more questions if you feel comfortable doing so and picking up more information. Beyond that, the morning cohorts, after this is done, you're free to go. Your day is finished up, at least with us. Obviously, we have some assignments to take care of. If you have questions, feel free to reach out to Matt, Aaron, or myself. We'll help you with that. And then the third cohort, our afternoon group, obviously we'll need to walk back down, and we'll be meeting in room 123 this afternoon. So, again, thank you for your time. Thank you for being a part of this, and thank you to our panel for being here today.